We can speak now to Adrian Brown, who's a bariatric dietitian. He works with patients before and after surgery, advising them on dietary changes, and he's in our Birmingham studio for us. Now, thanks very much for your time today. Do you recognise the findings of this report, especially that this kind of surgery is often being seen as a quick fix to solving obesity, and often patients don't really understand the risks involved?
I must say that the NC Pod report is very welcomed. But what it does highlight is what a lot of our healthcare professionals and dietitians already know, that the importance of the multidisciplinary team and also follow-up is essential. I think what is important is that patients do understand that bariatric surgery is only a tool to help them with their long-term weight loss, and that education beforehand and also before the time of surgery is essential.
So, you know, you work in this field. Just tell us what kind of preparation a patient would have before and after surgery in terms of psychological counselling as well as everything else.
From a point of view of our service at Birmingham Heartlands, we do a 12-month comprehensive package of care, even before that they've gone forward for surgery. So what we tend to look at is we tend to look at the skills that patients have, but also ensuring that they've made some permanent lifestyle changes beforehand, both from a dietary point of view and also eating behaviour. And then afterwards, they have a 24-month follow-up within our service, being reviewed every 3 months to ensure that any complications are highlighted very soon.
Well, I mean, it sounds like the sort of care you're offering is perhaps not typical. I mean, if this report is to be believed, for example, they're saying they found that 32% of patients didn't receive adequate follow-up after surgery.
I think what this does actually highlight is that a vast majority did receive some care. However, there might be some services within the UK that aren't following proper regulations and procedures for the bariatric patients to ensure they're followed up correctly.
And this is an important issue, isn't it? Because, I mean, I think I'm right in saying that obesity is becoming a more and more significant health problem. In other words, more and more people are suffering from this, and therefore, presumably, this kind of surgery is going to get more and more common. Very
much so. Obesity is almost seen as an epidemic now, and the West Midlands has the highest rate of obesity within the UK. And a recent report actually highlighted that the UK had the highest rate within Europe. So we're actually looking at a large population that are becoming more and more obese. So it's important to get, you know, not only the surgery involved, but also the care before and after the surgery absolutely right. Absolutely. The pre-surgery care is absolutely essential. And actually what we find is that some patients actually decide not to go forward for surgery if the care is right beforehand. However, there is a group of patients who will benefit from surgery, and therefore those patients, it's really important that they get the right aftercare and they get the right support afterwards, not just from a point of medical, dietary, but also psychological as well.
But, I mean, is it a problem that people see surgery as a quick fix, as opposed to changing diet and so on?
I think one thing that was highlighted, particularly from the report, was the importance of advertising within the private sector and ensuring that there's proper codes of conduct related to that. Within the NHS, I think that what we do is we actually prepare the patient beforehand. So we give them all the information in terms of education and also leaflets, but also we encourage patients to go and speak to other patients who have had surgery. So for example, in our service, we have a support group that we advise patients to go to beforehand so that they're fully aware of what surgery will do to their lives and onward.
OK, Adrian Brown, thank you very much indeed for your time this afternoon. Thanks.